I'm Pamela Wu, and with me today, virtually, is Dr. Dean Blumberg, Chief of Pediatric Infectious Diseases at UC Davis Children's Hospital. Today, we're going to be discussing COVID-19 and its intersection with flu season and what you can do to keep yourself and your family healthy and safe. Dr. Blumberg, I know you're a busy guy. Thank you for being with us.
Yeah, of course.
We're soon going to be entering flu season during the COVID pandemic, where the Delta variant is still spreading throughout the community. As an infectious disease doctor, what are your thoughts about the intersection of these two?
Well, it's been really interesting. Remember what happened last year? People were worried about a bad flu season on top of COVID, and it didn't happen. And the reason it didn't happen is because we had everybody who was masking and social distancing, and many things were still closed because of lockdowns. So we had really historically low rates of influenza and other respiratory virus transmission last year. In fact, here at UC Davis Hospital, we didn't have anybody admitted for influenza last year. It's amazing. And even looking at nationally at children who die, unfortunately, from influenza, normally somewhere between like 40 and 150 kids every year die from influenza. Last year, just one child died from influenza in the US. So that just shows you now that how much the masking and social distancing really helped. Now this year, of course, things are much more open. And we are already seeing transmission of respiratory viruses like influenza in the community. So it's not going to be the same. And people have lost a year in terms of being exposed to influenza and developing some sort of protective immunity. So, we do expect a return to a more normal influenza season this year. It might be even worse because people have not been exposed to influenza recently. So I would really encourage everybody to get vaccinated this year. It's really more important than ever.
I'm really interested to hear more about your expectations actually for this year's flu season. As you mentioned, the variables are different. People have relaxed a little bit. So many adults in particular have gotten vaccinated. Then we have the Delta variant, which is so much more infectious than the version of COVID that we dealt with last year.
Mm-hmm.
So what do you see moving forward?
So for COVID, the models suggest that we are starting to plateau from the recent surge in California and in the US. But the models also suggest that sometime around December that we're going to see an increase in the number of cases, likely because coronaviruses traditionally are transmitted more in the winter. There are winter respiratory virus. In the winter, the temperature and the humidity favor the viral survival, and that's why they are transmitted more in the winter. So, and that's also when we're going to see an increase in influenza cases too. So I think that's what we're worried about, is influenza increasing on top of COVID increasing because Delta is such a transmissible strain.
So all the more reason then to continue distancing, masking, washing hands, and the obvious thing too, of course, for people to get their flu shot this year. How important is that going to be?
Well, I think it is important. As I mentioned, last year we didn't have much influenza circulating, and usually you get some immunity that builds from year to year, and you get some memory, immunologic memory of the previous strains that were circulating, which help you fight off future infections. We know that the influenza vaccine is recommended, it's good, but doesn't always match 100% the circulating strains. So prior immunity is important also, and we really missed out on that. Good, it's great that we missed out on that because we didn't have much circulating flu last year. But the downside of that is that our immune systems may not be as strengthened, as trained to respond to a flu infection in the upcoming year.
So what are the types of flu vaccines that are going to be available to patients this season?
Well, we got all the types that are available from before. So we've got the inactivated vaccines, the ones that are injected, and then we also have the live nasal spray vaccine that's available this year too. One thing that's different this year is that all the available vaccines are quadrivalent vaccines. They contain 2 A strains and 2 B strains. And that was something that I looked for myself when I was getting vaccinated, is Sometimes there were quadrivalent and trivalent vaccines, and if I'm getting a shot, I might as well get immunity to like 4 strains rather
Yeah,
than 3. Why not?
more is better.
Yeah, there's no downside to that. So you don't have to worry about this here. All of them are quadrivalent. And also for people who are over 65 years of age, there's the specialized vaccines, ones with adjuvants that help rev up the immune system and give a better immune response, or the high dose vaccine, or others that may be recommended for that age group.
So for people who are considering getting the COVID vaccine and the flu vaccine, I know a lot of folks are wondering if they can get them at the same time, right? One doctor's office visit.
Mhm.
Would the side effects be potentially more pronounced if folks were to get them at the same time? Can they get them at the same time?
Yeah, so the CDC is recommending that you can get the COVID vaccine and influenza vaccine simultaneously, or you can get them separated by any interval that you would like, by a day or a week or a month, whatever you want. The recommendation is to have the injections at separate sites, and so generally that's going to be one in each arm if you get them simultaneously. I know personally, I'd rather just get it done all at once, and might have 2 sore arms, but I'd rather just get that rather than space it out. So that's what I'm going to choose to do.
Is there anyone who should consider spacing them out?
I think people who are concerned about the side effects, who might, for example, need an arm available for their work or for school, if they don't want their dominant arm affected, then maybe they should space it out and get both shots in the other arm. That would be one option.
For folks who are concerned about, soreness or other common normal side effects of receiving one of these vaccines or the other, what is the recommendation about taking pain relievers either before or after either of these shots, flu or COVID?
Yeah, for theoretical reasons, it's recommended to take pain relievers afterwards if you would like to do that, and not before. And that's based on these theoretical reasons that studies with other vaccines in children suggest that taking any anti-inflammatories, either Tylenol or ibuprofen or others, if you take that beforehand, if you take that prophylactically, that the immune response may be dampened a bit. Now, it's not known whether that's clinically significant or not, if that's going to result in more people being susceptible to infection with COVID or influenza, but it's a theoretical concern. So the CDC recommends don't take it beforehand, but afterwards you can certainly take it after you're vaccinated. And I would encourage people to do that because we don't want people being miserable after they're vaccinated. That's going to be a disincentive for influenza vaccine for next year. And for COVID vaccines, we know that we've been rolling out these booster recommendations. And so people might have boosters in the future for COVID, and we want people to feel comfortable.
You and I talk a lot about anti-vaccine sentiment and vaccine hesitation as well. And, for the audience, and I know you, Dr. Blumberg, see this, there's a difference between the two. Some folks are like, no way, no how. And some truly are on the fence about whether to get shots. They're seeking good, reliable, credible information. What kinds of questions are you hearing from hesitant patients and their families? And how are you addressing their concerns?
Yeah, there's a lot of misinformation out there that people hear, or other real true concerns that people might have about that. And it's important to put that into context about the dangers of the disease. And, the vaccines, all of them do have side effects. So it's important to take those seriously too. So what I'm hearing is a lot of individual concerns. A lot of people have different concerns based on, some people think that COVID's not that severe a disease, depending on what age group. Other people are worried about, people have heard about COVID vaccines and fertility, for example, and there is no scientific evidence. There's no evidence at all that the vaccines affect fertility. There's issues related to myocarditis. So there's a whole bunch of things that people are concerned about. And then some people think that natural immunity is better than the immunity you get from vaccination. And, so it's important to ask those questions and discuss them. And, the vaccines provide a much more reliable immune response than infection. And the vast majority of studies find that the vaccines induce better and longer lasting immunity compared to infection. So all of these things, if people have these kind of questions, I go to traditional websites to get my information, like the FDA, the CDC, and for children, the American Academy of Pediatrics. But there's other websites that are reliable out there that you can get information from, and talk with your doctor or send us a question. We're happy to respond to it.
Dr. Blumberg, aside from getting the flu vaccine, what are your other preventative tips for flu?
The other things that you can do are the common sense kind of things, like don't be around sick people. And that's not always feasible, but if I'm out in public and I see somebody coughing or sneezing or looking miserable at the grocery store or somewhere else, even if they're wearing a mask, the masks help, but they don't work 100%. But I move away from those people if that's feasible. Obviously, that's not always feasible. If you're on an airplane, for example, you can't just like switch your seat all the time. But try to avoid being around sick people, and you can do this with your friends, with family. If family members get sick, try to isolate them at home, while not ignoring them, help them, but try not to spend too much time around them, because household contact is a very intense kind of a contact, and that's a very high risk for infection. Washing hands is a good idea, but masking is really great, because masking really helps prevent not only COVID, but influenza and other respiratory illnesses.
What are the symptoms of COVID versus flu? I'm going into flu season, you are going to be receiving a lot of these questions from patients.
They're very similar at the beginning. You really can't distinguish them, because they both start with upper respiratory symptoms, with cough, runny nose, fever, maybe sore throat. Where they differ is that COVID tends to be more severe than flu. So COVID can, especially in unvaccinated individuals, can cause lower respiratory tract disease. It can go to the lungs and cause pneumonia, and this can result in shortness of breath. That's much more common with COVID compared to influenza. And then COVID tends to cause the loss of taste and smell more often than influenza. It may happen with influenza, but not as much as with COVID.
It now looks like the COVID vaccine will soon be available for children ages 5 to 11. I know that the families of your pediatric patients are pretty excited about that. What should parents know about the COVID vaccine for kids?
Yeah, so for the 5 to 11-year-olds, Pfizer, the manufacturer, submitted a press release last week. So we got some information from that. And in their press release, they said that the side effects were very similar in the 5 to 11-year-olds compared to older children and young adults. So it seemed to be well tolerated. And the immune response was very similar also. And this was in response to a lower dose of the vaccine. So what they chose was a dose, a third of the dose that's used for 12 years of age and up. So it was a 10 microgram dose. So it appears that they hit the sweet spot in terms of getting the appropriate immune response and also limiting the side effects so that it was tolerable. They didn't have enough infections to prove that it actually protected children. So that will come later. But since the immune response was the same, we do expect similar protection to the older age groups. They submitted this information to the FDA today, and so that now it should become publicly available when the FDA has some meetings. So I'll be really interested to actually look at the data myself, because the FDA has been very transparent with that sort of information. And the turnaround time after submission to the emergency use authorization has generally been about a month. So we do expect sometime next month to have the emergency use authorization. And I have confidence that the submission will achieve that, because Pfizer's done this before, and they're a well-known company, and so we don't expect any missteps or anything.
So awaiting some more data, and fingers crossed for next month. I'm the parent of a child in that age group, so I'm going to be marking my calendar for it. I'd like to learn a little bit more about the calibration of the dose that you mentioned. It's a third of the adult dose. What is that based on? Is it based on a child's size, or their immune system is different?
Yes and yes. So it's based on both of those. So younger children are obviously smaller on a weight basis, and so oftentimes doses of medications are dosed based on weight. And then the immune response among younger children tends to be more robust than older children and adults. And so oftentimes for priming doses in this age group, a smaller dose is used. And we really don't know what the dose is until it's actually tested. So you actually have to test the dose, because the dose, maybe the 10 microgram dose, it could have been that it was too small and the immune response was too low, or it could have been that it was too large and resulted in too many side effects. So that's why you actually have to do the study to find out if it works and if it's well tolerated.
To hit that sweet spot, as you
Mhm.
said.
Right.
Similar to adults, do you advise for kids it's fine to get both the COVID vaccine and the flu vaccine at the same time?
Yeah, we fully expect that when the emergency use authorization comes out, the CDC will come out with guidelines, and we fully expect those guidelines will be very similar to the older children and adults, which will be that influenza vaccine and COVID vaccine may be administered simultaneously or separated by any interval.
If I'm a patient in your clinic and I'm thinking that, because maybe I get lots of arm soreness or something, I decide that I do want to space them out one before the other. Would you recommend a certain one first?
Well, I would pay attention to what's going on in the community. So right now, we know that COVID is much more of a danger, much more of a risk than influenza. But that could change later in the season. I mean, COVID might settle down more and influenza might rise up more. But right now, the priority would be COVID.
Is it okay to get a flu shot or the COVID shot if you currently have cold symptoms?
It's okay if you have cold symptoms and they're mild. So for example, let's say you've got like a very low grade fever of 99 and sniffles and a bit of a cough, that's no problem whatsoever. But if you've got a fever of 103 and you're throwing up and you've got diarrhea and you're in bed all the time, wait for that to get better before getting vaccinated. That would be my recommendation.
Certain groups of people who are more than 6 months past their second dose of the Pfizer COVID vaccine are eligible for boosters now. You mentioned this a little earlier in the conversation. This includes older people and people who are in jobs with a high risk of exposure. For those getting their third shot, what side effects should they expect? What should they know?
The CDC just released just this morning, they released some information on the third doses. And what they found was that the third doses, the side effects following the third dose were very similar compared to the side effects following the second dose. So we know that there's more side effects following the second dose than the first. So based on your own experience, I would expect the same thing that happened after the second dose. With systemic side effects may occur, so you can have fatigue, fever, headache, and you can also have the localized side effects, the arm soreness and redness at the injection site.
So the second dose for some folks, myself included, was kind of a surprise in terms of what the side effects look like. So now we can be prepared if we think the third will probably be similar to the second.
Yeah, it's a biologic phenomena, and so it's really not predictable. I mean, I got my second dose, my arm was sore for a day or two, and that was it. And I was working, I didn't have any interruption at all. My wife got the second dose. She had the worst headache and she was in bed all day. And when I got home, I said, you should take a naproxen or something. And she did. And like within 2 hours, she was feeling so much better. So don't be a martyr. You can medicate with pain relievers if you do have significant side effects. And based on my experience with my wife, they work very well.
All right, really great information today. And we're nearing the end of our time. Do you have any closing comments you'd like to share with us? Final thoughts about really the importance and safety of getting vaccinated?
Yeah, so for the COVID vaccines, we've heard a lot about the breakthrough infections. Remember that for those who are fully vaccinated, for most people who are fully vaccinated, the breakthrough infections are mild. It's like having a cold or the flu. It's something that we live with every year where, we go out and about with our business, we go to concerts, we go to houses of worship, we go out to people's houses for dinners and to parties. And if we get sick, if we get the flu, if we get a cold, we stay home for a couple days, and we accept that risk. And I think that's our what we should expect in a post-pandemic world, is that the vaccines will protect against serious infection. So if after 6 months, people who are fully vaccinated have waning immunity for those mild breakthrough infections, I think we can live through that. What we don't want is the serious infections that result in people needing to be hospitalized and in the ICU. And that's what we saw early in the pandemic in New York City, in Italy, in Iran, and India. where hospitals were just overwhelmed and people were running out of oxygen. We just can't have that. So that's the reason for everybody to be vaccinated. That's most important, for people to be fully vaccinated. The boosters are less important except for people at risk for more severe disease. And where that's clear is people over 75 years of age, maybe over 65 years of age, and people with weakened immune systems or serious underlying conditions that put them at more risk for severe disease. So that would be, in terms of what I would emphasize. And then everybody every year should get influenza vaccine. And this year, likely it's more important than others.
You mentioned the vaccine really, preventing serious illness requiring hospitalization or death. This is exactly what we are seeing in our hospital, I'm told from frontliners such as yourself, that I won't even say the vast majority, but the overwhelming majority of patients who are sick in the hospital with COVID are unvaccinated.
Yeah, in our hospitals and other hospitals, and even groups that are reporting statewide aggregate data, it's been very consistent recently over the past several weeks and month or two, that with Delta being the predominant strain, that approximately 90% of hospitalized patients and deaths due to COVID are in unvaccinated individuals. So the vaccines continue to protect very well against the most severe illness. And that's what I want. That's what I want for myself. That's what I want for my family. That's what I want for our community and for society, is to prevent those more severe infections. And it's less important to me to protect against the more mild breakthrough infections, because we accept that all the time, every year with respiratory viral season.
Dr. Blumberg, thank you so much for being with us today. We really appreciate your time and the very, very, very good advice that you've given to us.
All right, thank you, Pam, for the opportunity.